Cervical cancers are the second major cause of the cancer-related deaths in women, second only to the breast cancer. Still recently they were number one, but recently the trend has been changing. Now there will be more of incidences in the rural population than the urban population. Now what are the risk factors for this cancer? One is multiparity, increased number of the pregnancies and deliveries in women, or if they're having multiple sexual partners, or if their sexual activity has started earlier in the age, or they belong to socio-economic status, they do not maintain the proper hygiene of the area, or they have been having any kind of the hormone replacement therapies or hormonal treatments being given. And more importantly, if they are having what we call HPV infection, human papilloma virus infection, and if they are immunosuppressed or immunocompromised and are having HIV infections or chlamydia or herpes simplex, that would again increase their chances of having the cervical cancers. Now coming to the signs and symptoms of the disease, that would depend upon the stage in which it has presented. If the ladies are having any kind of the pervaginal bleeding which does not correspond to their normal regular menstrual period, they should seek help for that. Now coming to the signs and symptoms of the disease, that would depend upon the stage in which the patient has presented. In the earlier stages, the woman might just present with unexplained pervaginal bleeding which does not correspond to her normal menstrual period, or if the lady is having unexplained postcoital bleeds, or if the lady has already attained her menopause and still is having an unexplained bleeding per vagina. How do you prevent these cancers? Coming to the human papilloma virus vaccines that we have in the market these days, they can give you protection against a lot of strains that can cause cervical cancers. So that should be started in an age group between 9 to 12, although you can start it up to 26, or in certain countries it's being allowed just before you have started your sexual activity up to that age group. Now what are the other things that the lady can do to prevent? Maintain a proper hygiene of the area. You can use what we call barrier methods or condoms to prevent you from getting the sexually transmitted diseases. That will just bring down the risk a bit. If you're having any sexually transmitted diseases, get them treated earlier in the stage. You should cut down the alcohol levels, you should stop smoking, you should take any kind of hormone treatments under the strict supervision of the doctors that you have around or who have prescribed you those treatments. And last but not the least, you should limit the number of the sexual partners that you are having. And now come to the screening part. We are having pap smear as screening. It's recommended that the ladies should, at least after the age of 30 or 35, should start with the annual screening or pap smear screening, what we call. And in case any kind of abnormal cells are seen in that pap smear, you will be advised by your doctor what should be the frequency of your pap smear screening, or what is the next step that needs to be taken for that. Stay safe.